Vortioxetine is a drug that inhibits the reuptake of serotonin. It is used to treat major depressive disorder. In this video, I'll share my visual mnemonic to help you remember all the important information about vortioxetine so you'll be ready for test day. Alright guys, we are taking it back to the good old days in the research lab for this one. Check out these two students working late at the lab bench. After running this experiment all night long, these students are closely watching the vortex mixer to see if the experiment was a success. Speaking of, let this vortex remind us of vortioxetine. Get it? Vortex for vortioxetine? Vortioxetine is a drug used to treat major depressive disorder. We'll talk more about this later, but for now, just remember this vortex for vortioxetine. Since these students pulled an all-nighter here in the lab, it's obvious that they also ordered some takeout. And like all takeout bags, these ones have happy faces on them. You know, the smiley, thank you, and come back again bags. Speaking of, these happy faces should remind us of serotonin. Get it? A happy face for serotonin? Since serotonin is considered the feel-good neurotransmitter, right? Vortioxetine increases serotonin signaling by inhibiting the reuptake of serotonin. This increases the levels of serotonin in the synapse. All that extra serotonin binds to and activates serotonin receptors. As a side note, vortioxetine can also act directly as an agonist of serotonin 1A receptors and as an antagonist of serotonin 3 receptors. This is a minor mechanism compared to the reuptake inhibition, and it is not all that important. The major takeaway here is to remember that vortioxetine increases serotonin signaling in the brain. And after a long night in the lab, it seems that all was for naught. The experiment did not go as planned. Research can be really tough, eh? These students are pretty depressed. One of them even seems to be crying. Anyways, let the sadness of these students remind us of major depressive disorder, which vortioxetine is used to treat. Major depressive disorder is the formal name for clinical depression and is characterized by a depressed mood and several other symptoms, such as loss of appetite, anhedonia, or poor concentration. Depression is thought to result from decreased levels of feel-good neurotransmitters, such as dopamine and serotonin. As you may recall from earlier, vortioxetine inhibits the reuptake of serotonin, thereby increasing the activity of serotonin in the brain. This is obviously helpful in treating major depression. In summary, try to remember this sad, depressed student for major depressive disorder, which vortioxetine is used to treat. Wow, it looks like these students went through a lot of takeout food in the lab tonight. Check out all those takeout bags on the back bench with lots of happy faces on them. Well, let this excessive number of happy face bags remind us of serotonin syndrome. This is a major adverse effect of vortioxetine use. If you recall from earlier, vortioxetine is a reuptake inhibitor and agonist of serotonin receptors. And we know that any drug that modulates serotonin can lead to serotonin syndrome, characterized by fever, tachycardia, altered mental status, and diaphoresis. Due to this reason, patients taking other serotonin-modulating drugs like SSRIs, tricyclic antidepressants, or MAOIs, should especially avoid vortioxetine. Try to remember this overflow of happy face stickers for serotonin syndrome, a major adverse effect of serotonin-modulating drugs, such as vortioxetine. There are just a few other adverse effects of vortioxetine that we should mention. It looks like this guy ate too much takeout and is now feeling pretty queasy. This queasy-appearing student should help us remember nausea, one of the potential side effects of vortioxetine. Other, less common side effects of vortioxetine include sleep disturbances and anticholinergic effects, such as dry mouth, constipation, or urinary retention. These side effects are pretty rare and really not that characteristic for vortioxetine, so we didn't symbolize them here, but we just wanted to mention them briefly before we close. Okay, all this talk about takeout has got me hungry. Let's wrap up and get out of here. Vortioxetine is a drug used to treat major depressive disorder. It works to increase serotonin signaling, primarily by inhibiting the reuptake of serotonin synapses. This increase in serotonin is obviously useful in treating disorders like major depression. An important side effect to remember is serotonin syndrome, which is more common if vortioxetine is given with other serotonin-modulating drugs. Finally, other side effects of vortioxetine include nausea, sleep disturbances, and anticholinergic effects. And with that, we are done with vortioxetine. I'll catch you in the next one.